to cover now is information about your newborn baby. So we've talked all about labour and what can happen around a labour and what happens if it goes wrong, that kind of thing. We've pretty much covered all the information around that, and we're going to get on with the fact that you've got this little person that you now need to make lots of decisions for. You are the responsible person in their life, making decisions for them, and about the caring for a newborn baby. We're not going to go into it in too much detail or too much time down the track, just the early weeks with a newborn baby in the early days. Alright, so when your baby first comes out, we're doing that check of them, making sure that they're adjusting to life outside of a uterus and without that cord being attached. And we give them initially a score that's called an APGAR score, and that tells us at 1 minute, at 5 minutes and at 10 minutes how they're adjusting to breathing and doing everything for themselves and their circulation changing. So your midwife will be doing that, and she writes that in your baby's book afterwards, so you can refer back to that and see what points your baby scored. But then pretty much once we know that they're good, that they're pinking up, crying, doing everything right, we're really focused on the skin to skin, so popping the baby up onto your chest for mum or for dad, and then that bonding, that sort of thing starts happening first. When I trained as a midwife, one of the first things that we used to do when a baby was out was do the measuring and the weighing and a bath and get them into their clothes and then eventually give them back to mum. Now we do it completely differently, that baby stays with mum or dad, skin to skin, and that the breastfeeding early happens. So within about 15 minutes to half an hour after your baby's born, they will start looking for food, because as soon as that cord is chopped off, they start to get a hunger. So, and we know that babies that get on early for that early breastfeed actually do much better with their feeding. So that's the focus for us. For the first few hours, you won't know how much they weigh, you won't know how long they are, anything like that. So once they've had that first really good breastfeed, that can actually last for up to an hour when they're first born, then your midwife will say, right, let's have a check of this baby. And so just to show you the difference between babies that are born a bit early and babies that are born at the right time, we've got a couple of posters here. So this first poster shows you what babies look like when they are born before the 40-week mark or before 37 weeks. We sort of see 37 weeks onwards as being due. So the top baby here is 25 weeks and looking quite scary, looking like it needs quite a lot of help, quite small. 27 weeks looking a bit less scary but still quite little, and then right down the bottom there, 34 weeks. That's looking way more like a normal sized baby, but just needs a bit more growing. And so the babies at 25 and 27 weeks we try not to see in Whangarei Hospital. If somebody comes in labour at that stage and they're having contractions, well, there's different drugs and things that we can try and give them to stop the labour, but if it doesn't look like it's going to stop, they get helicoptered down to Auckland pretty quick, because in Auckland they've got a neonatal intensive care unit, whereas in Whangarei we have only got a SCBU, which is a special care baby unit. We can take babies up here in Whangarei from 32 weeks. So that's way more like this baby down the bottom at 34 weeks. They're that bit bigger, they're just a bit sleepy, they need a bit of time to get feeding and growing and to get mum used to them. So that's babies that have come a bit early. And then what I'm going to show you is another poster of babies that have come on their due date. And so this is a average, normal sized baby, and they look like monsters on this poster, and you think, oh my goodness, they're huge, but they're actually life-sized babies. And we like it when these nice big fat babies come out. We know that with that extra layer of body fat and that extra bit of growing that they've had inside, that they actually cope much better with being born, with feeding, and with doing everything that they need to do. So we like these nice big fat babies. So the top baby there shows the cord clamp. So the clamp that we use in Whangarei Hospital looks exactly the same as that. But you can see around the belly button that there is a purple cream around there. This poster must be from America or somewhere else, because that's iodine. We do not use that in Whangarei Hospital. We just leave the cord alone. You give it a nice wee wash in the bath when you're giving the baby a bath and dry around it carefully, and that's it. So no creams or anything go on the cord. And you can see these bottom two babies. The cord clamp has come off, so when the cord is dried, usually around day 3, the midwife will take that cord clamp off, and then it takes about 5 to 8 days for the rest of the stump of the cord to come away. It does get quite stinky, and then eventually you'll take a nappy off and find that last little stump usually fallen off in the nappy. So these are nice big babies. I think this baby down the bottom here weighs 9 pounds 1 ounce. So we often do get quite nice, big, fat, healthy babies up here in Northland, and we like that. So nice, big babies. A couple of other things that midwives will do. So once the baby's had a good feed, then your midwife will ask if she can do the top-to-toe check of baby. So they usually do that in the room with you, so in the delivery room. Usually after the hour old, when they've had that good feed, there is a resuscitator table in the delivery room. It's a special little table that's got a good light, good heater, and it's got all the equipment that we need to do this newborn baby check. So we usually do it there. We bring in scales so that we can weigh the baby. We measure around their head. We measure from the top of their head to their heel. We listen to their heart and lungs. We move their hips around, checking for clicky hips. We have a look at their skin, looking for any birthmarks, and we turn them over and look down their back too. And often our Māori Pacific Island babies end up with these birthmarks, usually down their back and around their buttocks, and that's called a Mongolian blue spot. It looks just like a bruise, but it's actually a birthmark, and that does go away. So if your midwife notices any of those marks, she'll write that in your baby's book, which Natasha will show you soon. So we do this top-to-toe check. If you have a little boy and the midwife is checking your son, what she does do is she has to check the little penis properly, make sure that it's formed properly, and then if you see her fiddling with his balls and you're thinking, what's she doing? She actually has to feel for both of the testicles that they've dropped down into the scrotum. She needs to feel for both of those. If she can't, then that's one of the times that we call a paediatrician or do a referral to a paediatrician, and a baby doctor would come and have a look at the baby. So we need to make sure that that's all formed properly. So with boys, their foreskin is actually fused in place. You do not need to pull the foreskin back when they're in the bath. It takes up until about between 1 and 2, and then boys find their penises, they hold on to them, they hardly ever let them go, they play with them all the time, and they start to break that foreskin seal. And you'll slowly see it slowly retracts back. When you see that it's moving a bit in the bath, when in the bath you just teach them how to pull that skin back just gently, and it will slowly over a few months retract right back. So just show them how to clean it. Little boys have erections right from the word go, and so if you take a nappy off and the cold air hits them, they might get a little erection. That is totally normal for all newborn boys, and that keeps going. With boys as well, their balls can look really swollen and quite red after they are born. It is quite impressive. Make sure you get a photo of that. But then a couple of days it all shrinks and looks totally normal again and quite boring. But they can be quite swollen, and the same with girls. So their labia on the outside and around their vagina can look quite swollen and red. It's just a hormonal change from being born, and that again shrinks away. But something that girls can do is that they can have a mucousy discharge that comes away from their vagina, and it can be a bit pinky and look like there's a little bit of blood in it. It is nothing to worry about. Some little girls do this, some don't. So if you take a nappy off, see this mucousy discharge, just leave it alone. Don't try and wipe it away or anything, just leave it. It'll come away on its own. Always with girls, starting right from the beginning, wiping front to back, so you're not wiping poos forwards into their vaginas. So once you've done this top-to-toe check of your baby, they'll write everything in your baby book that you'll be given once you've had the baby, and then you can refer back to it whenever you want, or as you're watching the midwife doing the checks, you'll talk through all the different bits and pieces. If we find anything with your baby that we think is a bit different or maybe not quite right, we tell you straight away. I was looking at a baby once and one ear was formed perfectly, but when I looked at the other ear, it just had a pinhole sized hole going into its ear canal. And so that's a sign that that baby was going to have some hearing difficulties on that side. As soon as I saw that, a referral to the paediatrician, and the paediatrician came and saw that baby while it was still in hospital. So they can get a plan in place and do whatever they need to do around anything. But for the most part, babies come out and they are 100% perfect. When we're talking about your newborn baby, is about babies crying. Because we all know that babies cry. It's their one way of communicating with us that they're uncomfortable or hungry or tired or whatever. And it is a massive learning curve as the first time parent, learning your baby's cues, learning how to respond to them. And so we just go through a bit of a checklist of things that you can just start doing with the baby to learn why they might be crying. Another really good resource that you will get when you have a baby is this Power to Protect pamphlet. And then on the back of this pamphlet there is a really good checklist that actually you can tear off and put on your fridge or somewhere that makes sense for you at home, and it gives you the list of things that you can do with a crying baby, and so that when you're tired and you can't figure it out, you can just refer back to the list. So make sure you grab this pamphlet and put that list on the back of the fridge. The first couple of things that we totally recommend that you do with a baby that's crying, and usually the first thing you're doing is feeding them. So even if you feel like you have just finished feeding them, try feeding them again. Make sure that they're not hungry. Changing their nappy, making sure they're not sitting in a big punami or a big wet nappy that's making them uncomfortable. Checking that their temperature, so putting your fingers down the front of their clothing, or if they're lying on you, you can put your fingers down the back of their neck. And so what we're trying to get you to do is not feel their hands or their face, because especially in the winter months they can feel quite cold, but you're checking their core body temperature by putting your fingers down. And I really recommend that you start doing that right from the get-go when you have your baby, so you start to get a really good gauge with your fingers whether they're too hot or too cold. If they're either of those, then either adding a layer or taking a layer off, and trying to stick to really natural fibres around their body. So that's the first few things that you try if they're crying.
If you're not sure with using the finger thermometer, then get a digital one from the pharmacy, one that you put under their arm and it beeps until it's done, and then you can check their temperature. It should be between 36.5 and 37.5. So if it's lower, you can put a layer on. If it's higher, take a layer off. If it's getting to about 38, 38.5 and you're doing things and you can't get the temperature down, try skin to skin with them, because your body temperature will help bring theirs down. But if it's not coming down with everything you try, or it's still going up, that's when you need to be calling your doctor or Healthline, or taking them to the hospital to get checked out if it's nighttime. So trust your instincts. I'm going to go over some of the paperwork that your midwife will give you to read. Lots of decisions you need to make for your baby. And the first one is if you want them to have vitamin K or not. So this is a blood clotting agent that babies have low levels of when they're born. They do build up the levels over the first few months through feeding. We don't know if that's just low levels compared to us, whether they're supposed to have low levels, not sure, but we do offer vitamin K, and it's either done as a one-off injection in the thigh when they do the newborn check and it's done, or they've got drops that they can give them that taste really disgusting, and it's 3 doses spread out over a few weeks to make sure they get the whole lot. So read that, decide what you want to do. When baby's 48 hours old, there is a screening test for about 14 metabolic disorders. These are rare things like cystic fibrosis, maple syrup disease, rare things, and it's a heel prick test. Now, baby is going to squawk because they squawk about everything. Okay, it's actually more traumatic for the parents and the midwife. And what we do is prick baby's heel and then massage the foot until we can fill those 4 circles with blood, and then we send it off for testing. No news is good news on this one, but if they picked up anything, they would let your midwife know and she would refer you on for a diagnostic test. If you want the card back, just be aware it's going to have lots of little bits punched out where they've taken it for testing. We also offer newborn hearing screening. So if you have baby in the hospital, the ladies will try and catch you up there to save you another trip. But if you have a home birth or they miss you, they'll send you an appointment, and it'll either be up at the hospital or it'll be down in our community building on Commerce Street. And the machine that they use doesn't hurt baby. In fact, the younger they are, the better, because they sleep through it and we like them to sleep. And it just rests on their head and plays some clicking sounds, runs up a scale of noises and records the response. So we do that, check their hearing, it's free, it doesn't hurt them, and it's a really good idea to do that one. You'll also get given what we call the breastfeeding Bible. Usually we have to read massive books and do massive study days about breastfeeding, but the lactation consultants have condensed it down to the essentials for you. So this is really handy to have like on your table or somewhere handy for when you sit to feed babies, so you can check things like, have you got the baby latched on properly? Have I got a blocked duct or sore nipples, or my breasts are really full, what can I do about it? It's all in here. And also in there you get a whole load of paperwork about the unit, contraception, all sorts of things for you to have a read of. So that's that one. Now this one, you don't get a choice on. This is a legal requirement. You'll get given this. Your midwife registers your child's been born. You then have 12 weeks to go online and register your baby. If you don't have internet access, then you can also phone. But when you register your child, you'll be sleep deprived, and just make sure you check and double check and triple check you got everyone's name spelt right and everyone's birth dates right, because it's free to register them, but if you get it wrong, it costs and it's a hassle to change it. You can also order a birth certificate at the same time. There's pictures of them on the back of this card. So nice kind of scenic ones, or just a plain birth certificate as well. And those are $26.50 each at the moment. You need those for so many things, so it's a good idea if you can get it, put it away in a safe place. And also tick the box to get an IRD number for baby, so that then you've got that, because you also need that for lots of things. So make sure you do this one. If you haven't got a name sorted by now for your baby, I suggest you try and get a shortlist together. Yeah, because you'll be tired, and it's better to have a shortlist, and then you've got less names to argue about. Okay, you also need to think about immunisations. The immunisations start when baby is 6 weeks old, and the 6 week, 3 month, 5 month batch are all part of the same one. So if you start on those, finish them, because your child isn't fully immunised until they get the one at 5 months. So the 3 doses, then they should be immune to those illnesses. And as a parent, you feel awful. Take your baby along and they're cooing at you, and next thing they get an injection in each thigh, and yeah, you feel terrible, but sorry. Important, yeah. So have a read and decide about that. The rotavirus one is a live vaccine. So if you're having that one for your baby, make sure you wash your hands really, really well after nappy changes, because what comes out the other end, if you don't wash your hands properly, you will catch rotavirus, and it's really horrible. Sickness, diarrhea, one. You don't want that. The chickenpox vaccine has been introduced, and the HPV one, when they're about 11, 12 years old, is also available for boys now as well as girls. If you have any questions about any of the immunisations, there are phone numbers on there to get accurate information. Please do not Google or ask on Facebook about things like this, because people scaremonger, and you don't want to be making decisions based on fear. You need to make informed decisions about what's right for your family. Okay, so all the rumours that the MMR vaccine causes autism is not true. So please be careful where you're doing your research. And then if you're having your child immunised, it is recorded in that My Health book. So the old Plunkett book, they've renamed it, and it's recorded in there. So when they start at daycare or school, they want to see that page, so they know whether your child's been immunised or not. And then this book is their complete health record. So every time you see your midwife, your GP, your Plunkett nurse, whoever, it's all recorded in here. Growth charts, that newborn check that Monique spoke about, it's all in here. And you can see when all the other ones are due as well. There's also great information about what they're doing when, what they should be doing when. And at the back is the red first aid section. On the back cover are your useful phone numbers. Because I don't know about anyone else, but in an emergency you tend to forget the phone number, so it's on there. And National Poison Centre, you will need that at some point. And Healthline is also another really good one. Middle of the night, baby's crying, you can't work out what's wrong, they've got a temperature, call Healthline. And also Women's Refuge is all on there. Okay, so that's all your important phone numbers on that one. And then, if you've looked at the WINS and IRD websites and you can't quite work out what you're entitled to financially, both of these places offer a free budgeting service where they can help you work out what you're entitled to. So then you can make your appointment, go into WINS or IRD, and you know what you're asking for. So these are really great services. We've had really good feedback on them. So either of those. And then, if you qualify for a community services card, so you might not have it yet, but you might be qualifying for one soon, then Manawa Ora is the Healthy Homes Initiative, and if you've got a community services card, they can come to your home and see if you need any help with things like insulation, heating, blankets, curtains, all sorts of things like that. And we can do a referral for you, or social worker, Plunkett nurse. If you're with Tamariki Ora, all those kinds of people can do the referrals for you. And they can come and see what's what and help you make your house nice and warm and dry.
So for that time that Natasha's been talking through all the different little resources and decisions that you need to make for your baby, that's been like another 15 minutes of talking maybe. Often we sort of talk to people in our classes, do you think that the baby could have kept crying? I was talking before about a crying baby, and some of the first things that you do for a baby, like feeding them, changing their nappy, checking their temperature, if they continue to cry for 15 or 20 minutes, that is absolutely normal for a baby. Okay, they can often be quite settled during the day, but then as the day goes on, and especially into the evening when you're starting to get tired, maybe your partner's home from work or other family members are coming back, they're tired, and then the baby really starts to get unsettled. They call that the witching hour in the evenings. We like to call it the witching hours because it can go on and on. There is nothing wrong with the baby, they are just unsettled and crying. That is really normal for a baby, but it's really tricky to work out as a parent what is wrong with them. In the evening, you're just keeping on going back to the feeding. So go back to another feed, take them off for a bit, burping them, making sure they've not got an upset tummy from lots of wind. Try and feed them again. You can put them in a nice deep bath. Giving them to somebody else to bath the baby, so dad or another family member, to give you a bit of time out from the baby can be quite important. But a nice deep bath can relax the baby, back on for another feed, and then they might go off to sleep again. But just holding them, rocking them, humming, singing to them if you can, that kind of thing to just calm the baby down. You can keep going with all that kind of stuff for a while, but if your baby is really unsettled, we really make it clear to people in our classes that it's really normal to get frustrated with a baby that you can't settle. And it's a really important thing to know that if you are getting frustrated with your baby, that it's okay to put them down in a safe place and to walk away from them. So once you've done this list on the back of this pamphlet and you've done those things over and over a couple of times and made sure that the baby's not hot, they're not unwell, you've checked and made sure they're full, all that kind of stuff. If you feel your anxiety or your patience running out, you put them down in a safe place, so that's usually in their bassinet or their cot, and you can actually walk away, shut the door and have a breather from them for like 5 minutes. When you're away from them, you can probably still hear them crying. Give yourself a bit of a breather and then go back in, pick the baby up again and just start again with the list, working from the top things right the way down through. And hopefully by then the baby settles and does go off to sleep to give you a bit of a break. I've absolutely experienced this as a new parent. I remember being pregnant with my first son and thinking I was going to be Earth Mother and just love the baby all the time. I was never going to get frustrated with him. I was never going to feel like I wanted to shake the baby. I was not going to be that person. And then I had my first son and I loved him for about a day, and then I decided I didn't quite like him. I really struggled with feeding. He was really unsettled. He wasn't an easy baby to get to bed and to go to sleep. I had my husband home for a couple of weeks and then he went back to work, and I was that mum pacing up and down the hallway trying to get this kid to go to sleep. And I remember getting to the point where I held him and I was frustrated and I told him to shut up. And I remembered all this talk, and I had to go into his room, and I had to be careful even how I put him down, because I wanted to just put him down in the bed and walk away from him. And so put them down gently. When you do put them down, they absolutely scream. They realise that you're walking away from them. But I had to shut the door of his bedroom and then shut every door I could find into my bedroom, and I used to hop in the shower. And I would stand in the shower and be just bawling my eyes out, thinking, oh my gosh, I can't do this. I'm not a good mum. I can't figure this baby out. I'd have a good cry, and then I'd hop out of the shower feeling a bit better but looking awful. He'd still be crying, but I'd had a breather, go back in, pick them up again, do the feeding, do the humming and singing and stuff, and hopefully they go to sleep. But other things you can do when you've left them in their bed is you can phone Plunket Line. You can phone a friend that has had children and tell them that you're struggling. Phone your mum, phone a sister, phone somebody that gets it and that you can just talk to for a little while and say, I'm struggling with this. They can talk you through for a bit and then go back into the baby. Other things is to go outside, hang out the washing, just do a little job to give you a breather before you go back into the baby. It's a really normal part of adjusting to being a parent, and we all need to know it's okay to put them down and walk away.
I'm going to talk about safe sleep now, because every year in Northland we do have a few babies die of SUDI, which is sudden unexplained death in infancy. Now those are usually accidental smotherings by a parent, caregiver, a sibling, or they've overheated because they're wrapped up tight and snugly in these lovely soft polar fleece blankets, but basically that's like wrapping baby in a plastic bag and they overheat. So people will give you these. They're fine for like a play mat on the floor or in the pram when you're out and about, but not for wrapping them in to go to sleep. So there's things we need to do to keep babies safe. And that is having a smoke-free house, and they're going to be in their own sleep space in your room for the first 6 months. So whether it's a bassinet or a peppy pod or a wahakura or straight into a cot is absolutely fine. But the mattress needs to fit properly, not like this one, and it needs to be firm. So babies do not need a squishy mattress, they need a firm mattress, and we put them on their backs down at the bottom of the bed. So we tend to sleep at the top, but if you put baby up at the top, once you put all the covers over, if they wriggle, they're going to wriggle under the covers. So this way, if they wriggle, the only way they're going to go is up, out of trouble. So we put them in. They don't need a pillow. The pillow's there, keeps their airway nice and open. So this way, their airway's open and they've got lots of airflow. If you put them on their tummies, like babies used to get slept on their tummies, they're not actually getting that airflow and enough oxygen. So putting them on their backs, they've got all that airflow there. And people worry that they're going to choke when they spit up and things during the night, they won't. They either swallow it back down or they actually turn their head and it dribbles out. So you don't need to worry. So we want to keep them face up, face clear. We don't put any toys in there either. People seem to think that baby can see that and they'll enjoy it. They can't see it, and it's actually a smothering hazard. And also in the winter, people want to put babies to bed with little hats on. That is also a hazard because they can overheat and also it can slip down over their face. So we want to keep the bed as clear as possible. Then you've got the sheets and you make sure everything is nice and snug. Okay, when you do it nice and snug like this, that keeps baby feeling nice and secure, like that. And you go with your natural fibre blankets and tuck everything in, nice and snug. Okay, and then if they're in your room, you can hear every little grunt and burp and fart that they do, and it's like, oh, crikey kids, you're so little, you make so much noise. And then they go quiet and you panic and you're like, oh, are you okay? And they do a little, shh, go back to sleep now. Okay, but if they're right there, it's so much easier for you. You can hear them, they can hear you. When it's feeding time, you just get them up, feed them back in their bed. Okay, if you want a baby in bed with you, then there's safe ways you can do that. And they still have their own sleep space, but it means you're not going to roll on them. So this is a Peppy Pod, and then we've got a Wahakura. So these, like I say, in bed with you, baby's nice and safe, right next to you. You do use these a different way than you would a bassinet or a cot. But if you want one of these, talk to your midwife. The pods we can sort out for you. Often we do weaving wānanga to make your own Wahakura. Sometimes you can get hold of them from somebody who makes them, but it's important your midwife tells you the difference between using them out of the bed and using them in your bed when you're asleep, because it's slightly different. Okay, but it's all about keeping your baby as safe as possible. So face up, face clear, feet to the foot of the bed, smoke-free home. Breastfeeding helps protect them, and immunisations also help protect baby and keep them safe. This is from studies that have been done. So we just want to do everything we can to keep them nice and safe.